This is KLEAN Radio.
Hey, welcome to KLEAN Radio. This is Andrew Spanswick, your host. My co-host Judah is in New York, and he'll be joining us shortly by phone. And in the studio tonight, we have Dr. Jason Coe, or Alan Jason Coe, but he goes by Jason, just to make it confusing. Yep. And we're going to have a great show tonight. We have a lot to talk about. We're here broadcasting from 790 KABC. We're also on Sirius XM channel 243, as well as the internet, World Wide Web. You can reach us at KLEANradio.com. That's KLEAN with a K, of course, KLEAN radio.com, where you can go back and listen to well over 100 episodes of our show now. So anyway.
We're over 100 now?
Well, I think we're about, what are we at, Patrick?
It's like, I think 110.
110 episodes. My gosh, this is number 110.
Wow, that's great, huh?
Yeah, it's pretty amazing. So anyway, let's add Judah since he's in New York, and let's get him on the phone. Hey, Judah.
Hi, Judah.
Great to be here for all 110 episodes.
Right? You're actually not here for this one, but you're getting it's this ghost of Judah over the phone.
We'll give you credit, half credit at least.
Yeah. And but also let's welcome everybody out there. But it's also really important to talk about what it is you guys do, because I don't think a lot of people realize, at KLEAN, your guys' experiences, to the people that are out there listening. You guys have been in the industry for a long, long time.
Yeah, Jason and I met, I guess, about 22 years ago now, and we've been working together ever since in one form or another. And KLEAN is very much a culmination of those 22 years of work, plus the work that Jason did before me, because he's older. But
that's right.
That's
you
right.
always have to throw that in.
Yeah,
I've got 36 years now.
He's got 36 years of experience. Yeah. So Dr. Coe is a psychiatrist and the lead psychiatrist that works at KLEAN, and really the primary doctor there. And then, of course, I'm the CEO and executive, and I'm also a MSW and a therapist. So, we've been working together.
That's so important. The reason, Andrew, that's so important to talk about is because the people out there that are in trouble, that are going through a rough time, know they could come to a place where they're getting the best help, the most modern, up-to-date type of help.
Yeah, and that's one of the things I really want to talk about today is, we've taken a very different approach to treatment that I think is an evolution backing away from some of the brief treatments that have been introduced largely because of cuts in insurance or people's lack of willingness to pay for treatment or government cuts in treatment. And I think a lot of that began really probably in turn of the 80s and the 90s, early 90s. There was a lot of insurance reform.
That's when it started in the early 90s. And the 90s saw a lot of clamping down on benefits and a lot of managed care coming into the scene. And, we've been struggling with it, I would say, the last 10 years or so.
Right. So when I first started working with you, it was very much about Dr. Coe, it was about psychoanalysis, 90-day length of stay, sort of minimum for acute care psychiatric problems.
That's right.
Not just substance abuse problems, but we were dealing with substance abuse as well. And then we quickly saw an erosion down to about 2 weeks or 14 days. Average length of stay was approved by insurance. And now we're down in the hospitalization portion to about 4 to 8 days.
Right, and a lot of times 3 days.
Right, depending on the diagnosis.
Yeah.
So, a lot of what KLEAN was about was not just creating a great place for the treatment of substance abuse, but also that we could do dual diagnosis, meaning that people that are now quickly discharged from psychiatric care, inpatient, can come to a residential setting where they still get supervision and care 24/7, but also have exposure to great medical treatment.
Yeah, and a really careful evaluation, where an extended evaluation time where you can really figure out what that person needs.
And that's I think that's one of the big issues now. That, when people have these real big problems like an overdose, or they have suicidal ideation or try to kill themselves or something, a suicide attempt, often they'll be in the hospital for 4 or 5 days, and then they're just expected to go home and see just purely an outpatient therapist. And
Right.
often that's not the right environment for them to be safe.
Right. As soon as they think they can get them out of the hospital, they push them out. But, that hasn't done anything, and they really don't know what's going on. It's a matter of getting them out, unfortunately.
Right. And that's led a lot, I think, and from your profession's disappointment, especially I've heard you speak a lot about it, Dr. Coe, about how psychiatrists are seen just as pill pushers these days, and that you don't actually provide any therapeutic treatment.
That's true. A lot of psychiatrists only want to give medicine now. That seems to be the trend in training, and it's resulted in a lot of therapists getting into the game, and sometimes their training or experience is kind of limited.
It's interesting you call it a game, because in some ways it has become somewhat commercialized, and a lot of these different therapists, and now you don't even need a degree. You can call yourself a life coach and claim that you're an expert in therapeutic interventions.
Right. Yeah. So they're not even licensed. Yeah.
Yeah, they haven't been trained, licensed, or supervised.
Yeah.
So if
Exactly.
you just tuned in, you are listening to KLEAN Radio, so give us a call at 800-222-5222. That's 800-222-5222. And Andrew, last week on the show, we were actually talking about something very important about how people can get over the hump of making that 500-pound weight of a phone call to get help. What's our suggestions for people out there?
Well, I think, it's always hard to lift up the phone and call. One thing that's good is that you can call here. Nobody's going to know who you are. You can use a different name if you want. And also, if it's impossible for you to express, your fears or your needs over the phone, you can call our indirect number at our treatment center, where we have therapists standing by all the time, 24 hours a day, 7 days a week, that take intake calls. And that number is 800-601-6040. That's, it's 888-601-6040. So,
And it's absolutely free.
yeah, there's no cost to call. And if you're not the right fit for us or whatever, we point you in the direction of where you can get help. And if you're in a different state and can't make it to either California, Washington, or Oregon, wherever we have treatment centers.
And I think it's important to talk about. Yeah, sorry, Doc.
Yeah, I was going to address your point, and that is, it is hard to call because people have to deal with the shame of maybe they relapsed, or the whole moral thing that you're not a good person if you use drugs. You should be stronger. Well, that's not the case.
Well, and a lot of people still don't believe that the disease has or the addiction has a disease component. They still see it as a moral failing.
Right.
And, we now know from science that there's some very specific changes that occur because of the use of substances, including alcohol, that change the brain. And certainly, just becoming morally reformed will not save you from the negative consequences of an improper detox, which could result in death or, seizures and all sorts of other things.
Yeah, but
By
I'm
the way,
asking.
just on a side note, guys, I'm watching the video stream, and you guys look great.
Well, thanks.
Well, Judah, we're not watching you, but we know you look great anyway.
Trust me, I probably don't.
The,
Yeah, that's right. It's humid in New York, right? Your hair must be very curly.
It's actually, I'm having major hair problems.
Major hair problems.
bad hair day.
Sober with hair problems. It's okay. One of the things I want to talk about is because we've been trying to help people get into outpatient, because we realize we can't always give away beds for free too. We'd love to give away beds to everybody. One of the things we're offering is we're saying to people, we're going to help you out with outpatient, whatever it is you need that we can offer, and if we can help, we'll do that.
A lot of stuff going on. I guess there's been a few major relapses in the news. Sort of, and the issue of relapse I think is kind of interesting. Philip Seymour Hoffman finally admitted to actually being in rehab, but there was some rumors out there and that he actually sniffed heroin again, and that he had a prior addiction that I guess
I didn't know that.
Yeah, that it had been in remission for 20 years supposedly.
He had been sober for over 20 years.
Sober for over 20 years, and he actually broke down and ended up using heroin again.
Well, that's sad.
Yeah. Well, let's talk about that, though. I mean, in terms of, what does it mean when, people say, like, there's these treatment centers out there that say, this is the last rehab you'll ever have to go to. I mean, we know for a fact that that's not true.
How can you say that? How can you predict the future? They have a crystal ball? Or,
yeah, right.
Or
that we have the cure for addiction. That's another one that's out there on. You see a lot on CNN.
Yeah, right. I've heard of that one.
Right.
Yeah.
So it's these gimmicky sort of marketing ads that aren't really dealing with the truth about the problems that people are dealing with addiction and sort of the long-term care that it takes to manage this type of illness throughout one's life.
It's a chronic illness,
Right. And why do you think it is that people are able to get away with things like that, saying things like that?
They're advertising, it's appealing to people to think that there's an easy fix or there's a simple solution. But, if you think about it, there isn't. And most people understand that.
In the 70s, there was a rehab in L.A. that used to say, we'll give you in 30 days, we'll give you 1 year of sobriety. And that was actually an ad that was on in the 70s.
Yeah.
Wow.
That's unscrupulous. Yeah.
Well, you know what? Everybody out there, this is a great opportunity tonight to speak with Dr. Coe for free. He's a renowned psychiatrist, been practicing for 36 years, which he's allowing us to admit on radio.
Right.
And actually one of the best psychiatrists I've met and worked with in my career. Just amazing. Not a pill pusher, but very much into working with clients. So let's go ahead and take a call. We got Denise from New Jersey.
Hi.
Hey, Denise. How are you doing? Welcome to Clean Radio.
Okay.
Hi, Denise.
Hi, everybody.
Hey, Denise.
Hi, Judah. How are you?
Good. How are you?
I wanted to run something past you guys, and it's funny because you just mentioned, people calling for help, and you spoke of overdoses, and there's a bunch of us here, really two parents here that help so many people every week. We just get tons and tons of parents calling, asking for help. What can they do here in New Jersey, where the treatment is really, I should say there's a lack of treatment. For example, this week we had a child who overdosed. He was in the hospital for 2 days. They were going to discharge him at 4 o'clock. They had nowhere to go. Nobody would take them. Some have insurance, some don't.
Right.
We usually refer the no insurance people to state-funded, type facilities, hoping there's a bed free. And you guys every week, your message of hope and helping people. And I just wanted to run something by you that, we have one person that we, try to work with, but wondering if you might be interested if we, send some people your way if they were willing to send their child out of state.
Yeah, we right now we're only adults, so they have to be over 18, and so that's 18 and older.
Right.
But yeah, certainly we take a lot of people from all over the country. So.
Okay. I just didn't want to randomly send people your way, and most of them probably are adults. They're just parents like myself.
Right. We also work with some really good adolescent treatment centers out here that we can help refer you to, and we can facilitate the transport. There's all sorts of things that we can do. We've been in the business for quite a while, and we really know how to handle and work with families even from a distance. So any type of problem like that, just give us a call. On our direct line. That's that 888-601-6040 number. It's also on the website KLEANcenter.com. It's clean with a K.
So I think I'm sorry, Judah.
We're going to have our intake director call you tomorrow and get in touch with you personally.
All right.
Joe, I think you've spoken to before to try to coordinate that stuff.
Mm-hmm.
But I think, Denise, I want to talk about something because you're actually very open and honest about having a child that's gone through this.
Right.
To the mothers out there, to the families out there, how do you have enough strength to talk about this out loud? Because I think it's so hard. And how do you deal with it?
Well, to tell you, it's kind of two-sided. I wasn't always like this. I had to go and take care of myself first and go to my support groups, and I had to learn a lot. I had to learn how not to enable and to just breathe myself, put my oxygen mask on first. And so I've come a long way there. And I don't believe in tough love and so forth.
Good.
That being said, I also advocate whenever I can, just trying to help one child not go through what our child went through, and just help one family not go through the paralyzing pain that we went through. And I never realized, I just started doing it therapy-wise, and, it makes a difference. That's what gives me the strength every day. I hear all these sad stories, and been there, done that, and I could be there tomorrow. You know, I know it's a disease, and I would say my support groups and getting involved and trying to get rid of the stigma of addiction, but primarily in the beginning, my support group. And there's lots of them. I go to Families Anonymous, but, you know, Al-Anon is a great start, too. Just help yourself.
Denise, I want to ask you a question. How do you deal with the personal shame? How did you deal with that?
I never really had personal shame, I should say. Sure, did I walk into a Friday night football game and maybe have my head down? But I'm proud of my son. He's your boy next door. He's got a disease. And, you know, nowadays I can, you know, walk with my head up and, you know, stand tall because it's a disease. The more I speak out, the more I can try to chip away at the stigma of addiction.
That's a great message.
Yeah.
You know, and I think that's been so true not just for addiction, but for mental health as well. And
absolutely.
And
I mean, they run hand in hand, too.
Right,
I mean,
exactly.
So.
Yeah, I mean, one of the main reasons I got into this field originally was I was in college and I was thinking, well, you know, of all the people or groups that I could work with in the field of social science, which did I feel was most stigmatized at that point? And to me, it was the mentally ill and people with addictions, because basically people ignore them or are scared of them. Or they're very, very angry at them because they've had experiences in the family where they've had like an alcoholic father or whatever that abused them, or there was, you know, sexual abuse in the family or some other trauma. And, you know, there's so many co-occurring disorders that happen with addiction and trauma that happens with addiction and mental illness that, and it's so confusing and so hard to get help easily, far less good help and effective help. So, you know, that's a lot of what we're trying to do is spread this message that we're working very diligently on trying to, one, reduce the levels of shame for people to come into treatment, create more access, but also really increase the quality of care by bringing what we believe are the best treatment options available to the table.
I totally agree. And you know what, listeners listening to all of you in recovery every week, I think lessens the shame. The more that come out that are in the public eye, recovery
and how is your
is
son
possible.
doing?
You know what, dude? He's doing okay. You know, had some bumps in the road, but I would say the biggest thing, I don't know if proud is the right word, he's learning to use his tools and recognize when he's struggling and not letting it spiral. And had he not had treatment or been down this road, you know, a year ago, he didn't have those tools. He would spiral out of control, and that would be it. And he's able to recognize his triggers and ask for help, not be ashamed to ask for help. And, you know, making strides. You know, I guess with every, I don't call it a relapse. I kind of, at times, if it's one day in my mind, and I don't know who will agree with me or not, but if he has a slip, and there's a few kids this week that I know here from in town that had a 1 or 2 day slip, when I see them get back on the horse, and I see progress.
That's right.
I don't know if I'm right or wrong.
Well,
no, you're right. You're right.
I mean, it's a learning process, but he's doing great today.
We look for the overall trend of how things are going with the substance use. You got to remember that these people are in pain. Mm-hmm. They're suffering. Yeah.
No, I agree. It's a day at a time, and I'm grateful today. I'm sure he's grateful today that he's sober, and we take it a day at a time.
You know, Denise, we're out here on the West Coast, and there's this big influx of Molly, which is, a powdered form of MDMA. Are you seeing that a lot in New Jersey?
Oh, absolutely. It's so funny, too. I saw it recently on the news, too, and I called my nieces down in Florida, and my one niece had said it's all over the high schools. Right. And my message there to them was, you know, just because you can buy it over at the 7-Eleven or the gas station or somebody in school, these synthetic drugs and all these garbage drugs are just as fatal as every other drug out there.
Well, especially with Molly, they have this whole thing out there saying that it's, pure MDMA. And the truth of the matter is there's very little MDMA out there because it comes from an oil in a tree in South America, which is almost extinct at this point because they've cut most of them down. So most of these drugs that we're seeing are actually synthetic byproducts of other substances or mixtures of other drugs to try and mimic the effects of ecstasy.
Right. Well, it's big here. I know in town just from speaking to my, children, and when I call my niece, it's very big in Florida too. So obviously, it's across the nation.
Yeah, and the scary thing is people just don't even know what they're doing anymore. And we're seeing that a lot in the treatment center where people come in. It used to be you could ask them what have they been doing, and you had somewhat of a clue of what they were actually taking. Now we have to run tox screens on them just to find out, what's in their system.
Which I'm sure sometimes you probably can't even get on a tox screen.
Yeah,
that's right. Yeah.
It's tough. All right. Well, thank you so much.
Thank you, you guys.
Yeah, thanks for calling in.
Pleasure.
And we're just going to put you on hold for a second so that you can speak to Rand, okay?
All right. Sounds good.
Okay, great.
All right.
And by the way, if you just tuned in, you are listening to KLEAN Radio. That was Denise calling in, an amazing loyal listener. Give us a call at 800-222-5222. It's 800-222-5222. Andrew, I know we're coming up on the break in a second, but something I really want to talk about is, and I think Dr. Coe and you have amazing opinions on this, is that we try to prevent that you don't have to be 50 to get sober. That the younger you could still get this when you're very young.
The sooner the better.
That you don't. Yeah, that you don't have to hit a full bottom.
Yeah, often the problem is that addiction tends to be a family illness, and if the parents aren't healthy, often the children are following the next generation. And I just got back from London a few weeks ago, and I'm going there again for another conference, actually with Dr. Coe. Yeah, we're both going out there speaking on the 10th of June in London, and we're talking a lot about what is now we're seeing fourth generations of addicts where the family cycle hasn't been broken at all. And it's, right now they're using a public health model where the government actually provides the drugs to keep people maintained, so to try and reduce bloodborne illnesses like AIDS and hepatitis C, and to try and reduce crime. But it's ended up with a huge underclass of multi-generational drug addicts. So anyway,
and are you seeing? Sorry,
that's okay. Go ahead.
Are you seeing? Do you think there is a? But I think it's very important because you've always said that you don't have to hit bottom to get help. And I think people out there that are listening right now that are struggling, and they, when we were younger, we would, your mother would say, "Look at that, that's an alcoholic," right? You'd look at the bum on the street, and now, we're, like as you're talking about with kids in high school on Molly and all these different drugs, they don't have to hit that full bottom.
You're absolutely right. Let's talk about that when we come right back from our break. Yeah. And everybody out there, stay tuned for more of KLEAN Radio. We'll be back in a couple minutes.
Are you struggling with an addiction that's ruining your life? Want to have a confidential conversation with a professional that will immediately assist you? Do you suspect a loved one is abusing drugs and would like a free drug testing kit and consultation? KLEAN Treatment Center is standing by right now to help those with addictions and the people who care about them. Call 888-601-6040. That's 888-601-6040. Or go to KLEAN Treatment Center, that's KLEAN with a K, KLEANTreatmentCenter.com. Now back to Andrew Spanswick and Judah Friedman.
And Dr. Coe. Welcome, Dr. Coe.
Yes. Glad to be here.
Hey, Judah, how are you doing for the second half
good.
of the show?
I'm still here.
All right, you're still here in New York, huh? You haven't been washed away by another storm, huh?
Thank God, no. But there's something I wanted to ask you both about, because I was actually watching this show today called Taboo, and I'm sure you guys are both familiar with the show. But it was about these addicts in England that, get so bad and they go to Thailand to treat it with these monks. We're giving them these special concoctions. I'm not sure if you guys are familiar with this.
They actually shut down 2 of those already. There's we were having an enormous amount of deaths. They were basically saturating them with water and then detoxing them by making them sick with water. And
really?
it was almost a cultish kind of thing. And, it's amazing. But that shows you how desperate addicts are. Addicts get so desperate to try and get sober in some way that they think is going to actually work when other methods have failed, not realizing that, that those aren't solutions. I think the appeal of some sort of Eastern spirituality draws them out there, but then they give up all of the medical expertise that we have here in exchange for really what has become, found out to be a fraudulent form of treatment.
Yeah, Doc, I got to show you this, and I'm actually happy you guys are going to England, because these are the things you're talking about over there. Is that there is such a thing as dual diagnosis, which they're not.
Well, the
so
other major
with.
problem is they haven't believed in abstinence as a form of treatment for a long time.
Yeah, that's the big issue.
Right,
Yeah.
and that's really what we're doing over there a lot in Britain, is working towards building abstinence-based programming post-medical detox.
Right.
So we're going to be building medical detoxes and then moving into abstinence-based programming.
Right, and helping them identify who's a candidate for abstinence and who really can't do it. I
Right,
mean, there's some people who need harm reduction.
Yeah, there's some people that need long-term chronic care, which may include, utilizing things like methadone or Suboxone.
Correct. And they've taken a blanket approach and really kept everyone on methadone.
To shocking levels.
Yes. Oh, my goodness. Yeah.
Well, it's a good thing you guys are going there.
Yeah, no, we're really excited about it. This is going to be my third trip back there. And the more I go, the more I keep getting invited back to speak again. So I'm glad to bring Dr. Coe this time and broaden the conversation.
And so there are a lot of people out there right now that are listening that think they can't afford help. They don't know where to get treatment. And I think one of the things that we often talk about, Andrew and Dr. Coe, is that letting us be your advocate. Let us figure that stuff out for you.
Yeah, I mean, that's one of the reasons we have therapists who are also treatment advisors that are online 24 hours a day, 7 days a week. They're there to help screen and give you either referrals or help figure out, how to work with your insurance. These days, the insurance companies have made it so difficult just to even file a claim or find out what your benefits are. And it takes several days to get that process done. We have a whole staff secondary to the call center that then does what they call utilization review. In checking EOBs, which is explanation of benefits. So we have to spend a whole process of just finding out whether or not insurance will pay or not for a client. And then we'll work with the client from there once we find out what their benefits are or aren't.
And I just wanted to show a funny story that Rand, our director, gave us today about this woman that, is sober now from drugs and alcohol, and now she's addicted to bodybuilding. Obviously, we don't have those issues, but
I have it. Unfortunately, it's in my belly, not in my shoulders. But
you're right. We're sculpting our bellies.
That's right.
But it's important to talk about, because constantly we hear this, that people are talking about when they get sober. People are always like, well, now they're addicted to this, or now that's their crutch. And one of the things what's your thoughts on those types of things?
Well, if it's, I'm not sure what you mean by addicted to bodybuilding.
It means that every day, Doc,
it's just compulsive behavior, I believe. I mean,
I would say it's more healthy than doing the drugs, for sure.
Well, not if they're taking a lot of steroids and growth hormone.
Well, I didn't hear that part of it. That's a problem.
That's a big part of it, and I think a lot of it I've seen from clients that have gone to outpatient. I've seen secondarily that get into this. They end up they want to be able to use needles. They want to get high. They want to get that feeling one way or another, and they figure bodybuilding is a form of health promotion. When in fact, a lot of these drugs are somewhat dangerous. Well, no one's died from steroid use. It does seem to have long-term effects on organs and can reduce your lifespan. And then growth hormone, from what I understand, is particularly dangerous, because if you have an illness that shows up like cancer, growth hormone, I believe it, and Dr. you can confirm this, will increase the rapid onset of that cancer.
Well, it'll promote the growth of it.
Right. So
cancer is basically cells that are dividing too quickly. The other thing about growth hormone is if you start it and then you stop it, your body's going to be let down, and you feel weaker.
And some of your glands shut down, right? That produce certain.
Well, it certainly messes with all those delicate hormonal balances and feedback loops.
Right.
So it's tricky. The definition of addiction is any compulsive behavior that harms your life in some way, whether it's your biology, your relationships, your family, work, legal situation. And the other aspect of it is that people can't say no. Once and they really need a careful assessment of what's going on internally. that's driving this behavior. I mean, we know they're in pain, but, how does that all fit together?
And let's face it, if you're impaired and if you're driven by a compulsion, your ability to have good reality testing and think clearly about the world is impaired. So the chances of you, being able to on your own have an objective view and vision of what's going on in your life, and make sure that it's in a practical, healthy level is impossible without some sort of outside perspective.
Yeah, especially if you're clouded by drugs and alcohol.
Yeah.
Yeah, and I use drugs meaning of any sort.
Of any sort, yeah. Especially prescription drugs, since we're seeing huge numbers of problems with prescription drugs.
Well, and then the steroids and all that. I think it alters your brain chemistry as well.
Yeah, well, we definitely know about anger problems with steroid use, but also there does seem to be a high that people get off of it. So
that's true.
Yeah.
Well, there's also a great story about one of the founders of Starbucks. He's really wants to get into the pot market now, and he wants to almost branch out marijuana like he did with Starbucks.
You're kidding. I didn't hear that one.
Yeah, and he wants to put $100 million into this business of making it almost like Starbucks, but, I guess pot bucks.
I think you should save it for bail money from the DEA.
But this is something that's so important to talk about because, if you just tuned in, you are listening to KLEAN Radio, but, a lot of people have a very flippant approach to certain types of drugs, like we were talking about in the beginning, whether it's Molly, right, which is MDMA, and
alcohol. Alcohol is alcohol and tobacco. I mean, let's face it; those are the two killers, the biggest killers.
Yeah.
And we have I think the cultural adaptation of the use of alcohol in the United States is extremely poor compared to other countries. There's some that are worse, but we definitely have a culture of binge drinking and heavy drinking. There's or abstinence or temperance for religious reasons generally. So there isn't really a healthy sort of general, moderate use of alcohol in appropriate settings. You certainly don't see it in the TV commercials. So.
Right. There's a tendency with college kids to say, oh, well, that's what college kids do.
Right. They just go out there.
And that's not just with alcohol, though. That's with drugs these days, too.
Now it's with everything.
Danger.
Well,
we
hear from these kids now it's easier to get other drugs than it is to get alcohol. So, we're seeing people coming in where they don't even think about alcohol, really. It's like, it's just a beverage, to accompany their drug use, so...
No, but we're saying is that, a lot, we understand that people have their own ideas about whether marijuana should be legalized. The problem is that there aren't enough facilities that are set up once they do.
Well, I think all drugs should be legalized, and I know that's a very sort of controversial sort of position, but I think that, with that comes regulation, and with regulation has to come the taxing and then using that tax money not for increasing defense budgets or whatever, but for actually providing treatment for those that have been exposed to these substances.
Getting political on KLEAN Radio.
There we go.
But, and one of the
it's
things...
crazy to me that the alcohol isn't taxed and a portion of that tax isn't put back into treatment. I mean, I don't see how that's even possible. So.
Yeah, and you raise a good point, and then it's this constant fight. It's trying to get people help. Like we had Denise calling in, telling us about this huge drug problem in parts of New Jersey with teenagers, and the fact that they can't get them into rehab is with insurance or it's astonishing.
It's also a lack of beds, and the quality of beds and the quality of care is pretty poor. Most drug treatment programs haven't evolved since really 1950s. So they're still doing very primitive forms of treatment. The consequences of that is that people go in and then they lose hope that there's really any sort of treatment that's effective.
That's a good point.
Right.
Yeah.
Yeah, and if you just tuned in, by the way, you are listening to KLEAN Radio. Give us a call at 800-222-5222. That's 800-222-5222. And one of the things, Andrew, I want to talk about what we're offering is to people is that we understand a lot of people in this financial times are having a really hard time. And we're going to try to get you in if you need help, and we're going to try to get you in, obviously, into rehab. We'll also do everything we can to get you into outpatient care. And even if you can't afford it, we'll try to work something out with you.
Yeah, and this is all across the country. We have contacts not just here in Oregon, Washington, and LA, but we have contacts nationwide for outpatient care and helping people. And outpatient care is sometimes a good place to start. You can get an initial assessment as to where you are and what's going on, and whether inpatient care is necessary or not.
I actually started in outpatient care. And, I went from outpatient to outpatient. Obviously, it wasn't the right type of thing for me.
Right.
Because knowing my story, it didn't work. And, but it kept me in the system and it kept me in the loop so I could get help. And I think that's a very important thing for people out there about making that first call, is that once you make that first call, you might not get help right away, but you started the process.
Absolutely, and it's about sticking with the process as you go.
Right.
And then finding people that you can trust and work with over the long haul. They always say pick a doctor a little younger than you.
If the people tuning in right now, that won't be, no, I'm joking. I was about to say that won't be that hard, but if you're in your 20s and you're listening, or your 30s or your 40s, that shouldn't be a problem.
Exactly.
Is that safe to say, Dr. Coe?
I'm going to be around a long time.
Yeah, Andrew and I have discussed that often. You will be around a lot longer than both of us. Andrew, why don't you give out the information for people to call?
Yeah, go ahead. Let's get those numbers out again.
If you've got any questions or comments, you don't have to go on the air. Just call 800-ABC-KABC. That's 800-222-5222. Follow us on Twitter @KLEAN Treatment. Post your questions and comments on Facebook.com/KLEAN Radio. And watch the worldwide live video stream at KLEANRadio.com. That's clean with a K.
So, one of the things I wanted to talk about, and we didn't quite get fully into it, Dr. Coe, is how psychoanalysis has gone out of favor. And how when we mentioned that we do a fair amount of psychoanalysis at KLEAN Treatment Center, people think, oh, Freud and, 100 years ago, and, we're going to talk about your mother.
Well, Freud is, in some ways kind of outdated, but in a lot of ways we've updated, the theory. And when I talk about psychoanalysis, I'm talking about an underlying exploration and formulation, an understanding of what's driving the addiction, rather than just a cognitive approach where the person is not they don't look at what's going on in the person's mind. They look at
they're told they have a problem. They need to learn about the problem. They need to stop, but they don't talk about really.
Well, the mind is a black box.
Right.
What goes in is they look at what goes in and they look at what goes out. Okay, this is a problem. This is what you do. But I don't think that fits everybody.
You had a great analogy you told me earlier about brief treatment, cognitive behavioral therapy versus psychoanalysis.
Right, and psychoanalysis is pulling the weeds out by the root, and other forms of treatment, I think, are mowing down the weeds. They're going to grow back. So I think that we need to make a sweeping analysis of what's going on inside that person. And that's kind of forgotten these days.
What about medication? Do you think that, obviously in the 80s, medications were very primitive, although, they were much better than even before that. But there's been this huge boom in all sorts of types of medication. When are medications good to use and when are they not?
Well, there are a lot of different medicines now that can make a big difference. If you have somebody who's bipolar, obviously they need to be treated, and very often we find alcoholics, once they get off of the alcohol, it's very obvious that they're bipolar. Their thoughts are racing, they're restless, agitated, and I'm not talking about being in the detox, that these are people who are bipolar and have manic or mixed states or severe depressions. They need medicine. We also have anti-craving medicine that helps too. And by that I'm talking about, for alcoholics, I would include Antabuse, which is a medication that if you take it every day, you know that you can't drink because you'll get sick. And then we have naltrexone or the Vivitrol shot, which lasts for 28 days. And these have been shown with evidence-based studies to reduce drinking, as well as, they block the opiate receptor. So they also work for opiates as well. We're talking about pain pills, heroin, those sorts of meds. They're not medicines, but drugs.
What about the big antidepressant debate? They're saying that, I saw something on 60 Minutes, I think it was, saying that 40% of antidepressant use was a placebo effect. Do you think that's just from overprescribing, or?
Well, I think we get placebo effects all the time. I don't think it's that high. Probably 25-30%, though, is just the expectation of help. Mm-hmm. But you still need to give the medicine. Right. But it's clear that these medicines are psychoactive, and they do help people who are struggling. I kind of look at medicine as opening doors for that person who just doesn't have what it takes at the time to get through the door on their own.
Right. This past month, they actually announced that suicide was surpassing accidents in death of teenagers.
Yes, isn't that something?
That's truly shocking. Yeah, I was very disturbed to see that. So.
But I think it's also, by the way, very important that you're talking about this because, one of the cool things about KLEAN is we always say we don't know what came first, the chicken or the egg. We don't know what came first, the addiction or your psych problems. But we're here to treat both because we realize there's a need to treat both.
Well, I always see these people as numbing out their pain. I think that these are people who are in pain at some point in their life, oftentimes when they're teenagers, and they start using to cope with that pain, to numb that pain. And it gets in the way of just processing what it is that they're upset about or what it is that's causing their pain.
Well, we have another sober fact of the day. According to the Core Institute, an organization that surveys college drinking practices, 300,000 of today's college students will eventually die of alcohol-related causes such as drunk driving accidents, cirrhosis of the liver, various cancers, and heart disease. It's kind of a shocking number.
It's big.
It's large, yeah, definitely. Anyway,
but that's another thing. It's that we've talked about on the show a lot. You had a lot of permissive parents. You have a lot of parents that because they were from the 60s or the 70s, are very permissive with their kids. So they'd rather be friends with their kids than be parents with their kids.
That's a big mistake. Yeah.
It's a huge mistake. And so their kids go away to college, and they're not giving them other talks. Oh. They're not saying to them about the dangers.
A lot of that, though, is because of the breakup of the traditional family structure. I mean, you now have parents that are competing for the attention and love of their own child, right. Through divorce, which can cause disastrous consequences if you don't have two balanced, parents on both sides. So.
Yeah, and again, I'm Madonna, who's the last, her tour was named after,
named after Molly.
Yeah, named after Molly.
Really?
Yeah.
And that was that was her world tour, Doc, and there wasn't more of an uproar, and I don't really get that that we become that permissive that it's okay.
Yeah, she would actually get on stage and say, "Has anyone seen Molly?" Which is code for getting ecstasy or Molly.
Right. So you have parents that are taking their kids, 14, 15, 16
and not knowing
children,
even what's being said.
Right, but the kids know.
Yeah.
Which is the shocking thing, and then it becomes okay.
Yep.
Oh, it's the parents.
We're not a show about, we're not, to people out there that just tuned in, it's KLEAN Radio, we're not a show about telling people not to do things. But we are a show about saying to people that if you are, know what some of the consequences can be.
And also, if you've fallen into those consequences, we're here to help.
That you can get help.
The goal is to. The goal is to prepare people to have a real life.
Right.
Whether you're a parent or somebody treating at a treatment center, treating addiction, and drugs and alcohol in an addictive way is not living.
Yeah. Look, if you're out there, we've got 8 minutes left in the show. There's probably time for one more call. So anybody out there that wants to call in, our number is 800-222-5222. That's 800-222-5222. I'd encourage you to take this opportunity to give us a call. So, Judah?
Okay, yeah.
I was just thinking about that a lot. Is that, you don't have to, like Denise was talking about, you don't have to you don't have to fall into the abyss to get help. And I think to the people out there that are driving right now, that are listening at home, that are in pain, you could end that pain by giving us a call. And we are running out of time, so you can call that 888-601-6040 number. And the reason I'm saying this is because, Andrew, I got sober when I was 22 years old. So I was able to have an amazing life afterwards. And parents that are, scared to death for their children have to realize that there is hope.
Yeah, I think there's even hope for the drunk on the street. It's amazing. Right. And, these people that we walk by every day and ignore, or people ignore, they don't want to be bothered with, there's definitely ways to help those people. And it pains me that, we pay more attention to the dog they're holding than we pay attention to the person that's lying there on the street. So.
Well, I've seen your dog, so that's understandable, okay? I get why people are paying more attention.
Right, pet the owner, not the dog.
Yeah.
We spend a lot more money on cancer, diabetes, and heart disease, all chronic illnesses that affects a lot less people. Right. I'm not saying we shouldn't, but I think we need to.
No, Doc, it's an amazing point you make, because once a year, the NFL, and I always say this, and I'm shocked by this, it's great that they have breast cancer awareness month. But, if you look at all the problems the NFL has had, the fact that they don't have a mental health awareness month is shocking. With all the players that have had mental health issues,
Well, that's called denial.
Well,
and avoiding liability.
Yeah.
It's still the greatest taboo.
There's so much in damage control in the NFL right now, trying to avoid lawsuits from, their health insurance plans with all these cases of brain injuries that are coming out now. Yeah, it's a mess.
The important thing is, okay, so you guys are going to England. You guys are going to London next week. And I think it's so cool that you're bringing stuff from America. You're bringing in the knowledge of the 12 steps of dual diagnosis of all these different things. And I don't think people in America, it's amazing that we realize how lucky we are that we have all these tools. We're not using them. But that a place like London doesn't have the tools we have yet.
Yeah, they do for the higher end private market, people that have cash and are able to go to very high end clinics that are small, but they don't have it for the general population, which is also what we see a lot here in the United States, and that's one of the reasons that we've built our facility up in Washington. We were able to get beds at a very low cost, so that we can offer treatment at reasonable prices.
So I think it's amazing that you guys are going there and you guys are spreading this message. And I'm not just saying that because I know you guys. I'm saying that because it's true that you guys get to, go to this place where people are so in need for therapy or, getting sober, that 2 of them from London went to Thailand, to a place that was shut down. Because that's how hungry they are to get, help.
Yeah, definitely. It's amazing. This is an evolving thing. I think that everybody is still looking for the quick fix. We saw the articles last week on, there's going to be potentially a shot that will cure you of cocaine cravings. But, this problem of compulsive use of things to deal with one's emotional state or underlying trauma is not going to go away by. You'd have to have a vaccine for basically almost every kind of process addiction and substance on earth. That's not going to ever happen. And if they finally do, somebody will make up another one.
And how's that going to rebuild their life?
Right. It doesn't. It doesn't address anything other than leave them in pain and without any solution at all.
Right. Or as in the 12 steps, they call it dry drunk.
Or I was going to say something, but I'm not.
No, but it's very important that you talk about that stuff because, I don't think most people, and I know we're running out of time, most people don't realize that, you can deal with both. And I think that's what you were talking about when you were talking about before about the older models, is that there was one model of how to get people sober. but we've evolved.
Yeah, absolutely, and we're still evolving, and we're learning things every day, each individual is different. I mean, just if you look at the difference in the treatment of bipolar disorder in the last 20 years, it's impressive the changes that have been made. And you look at the treatment of major depression. I mean, even things that were hard, like electroconvulsive therapy, have even been refined into effective treatments for geriatrics by improving them scientifically. So, a lot of the things that people were scared about because of psychiatry and because of mental health and because of addiction and the way it was treated in the past have kept people out of the system. And I think that people need to become aware that the options now are much better, much safer. The ability to detox people safely is easier. I hated watching, Dr. Drew's rehab show. I watched a couple episodes of that, the last part. And, they had clients on there having seizures and throwing up, and that shouldn't be happening. I mean, that's not necessary. There's medications and detox protocols we have that avoid those types of withdrawals, but there's still this belief by some medical practitioners that people should have a painful detox so that they sort of remember that it's painful to get off, so they shouldn't get back on, and that's just really not how it should be handled.
That's right.
We couldn't agree. I couldn't agree with you more.
I mean, the fact that they're willing to take the risk of letting people have seizures is just unbelievable to me. I mean, it's like,
right.
People can die from one seizure.
And you want to know the biggest truth is, Andrew? They don't understand addiction. And the reason I say that is because we always talk about you can't punish an addict worse than they punish themselves.
Right.
So if you think that somehow them feeling their detox is somehow their punishment or their penance, you've really misunderstood what addiction is.
Yeah. Well, we're down to our last minute here. I'd like to thank you for calling in, Judah from New York.
Yeah. Thank you. I'll be in next week, but you guys won't.
That's right. We're just going to keep switching.
Yeah.
Say hello to your parents for me and Melissa.
Will do. You just did, actually. and I will talk to you guys later.
All right. Thanks.
All
right. Dr. Coe, it's been a great show. Thank you for coming back on.
My pleasure.
And as always, you're available at KLEAN Treatment Center. We encourage people, that need help to give us a call. You can call us at 888-601-6040. We're always available for help, and hopefully people will get to meet you if they do need help.
That's where I spend most of my time.
That's right. You'll be there. Yeah. Exactly. So I'll be out of town next week, but hopefully within the next week I'll be back in the studio, and certainly I'll be trying to call in and make things go. So anyway, thank you for listening to KLEAN Radio. Talk to you next Sunday.
Are you struggling with an addiction that's ruining your life? Want to have a confidential conversation with a professional that will immediately assist you? Do you suspect a loved one is abusing drugs and would like a free drug testing kit and consultation? KLEAN Treatment Center is standing by right now to help those with addictions and the people who care about them. Call 888-601-6040. That's 888-601-6040. Or go to KLEAN Treatment Center, that's clean with a K, KLEANTreatmentCenter.com.